So here we are about 24 hours after the laser. There's still some purple mark on the skin. Sometimes patients focus on that. Don't worry about it. Some areas are a little bit weepier. Those are going to be cleaned. We're going to show you an after in a second here. And this is a pretty good state. Now again, we're 24 hours after, and there's been at least 2 good cleanings since coming home from surgery last night till this video you're seeing right now. This is a pretty standard setup for good post-laser care cleaning. You will want to have a large supply of these little medical, well, not medical, but the makeup remover pads. The isopropyl alcohol has been used to clean the spoon. The Vaseline has been dispensed onto the spoon. This little container here was heavily cleaned in a dishwasher, and then we put some distilled water with vinegar in there. And again, at the time of this video, we're recommending this foaming facial cleanser, but that may change over time, so products do come and go, but at the time of this video, that's the good product for getting the goo off the face. So these are kind of our basic supplies. Key things again, when that Vaseline goes to that spoon, if you have a jar of Vaseline, you never go back to the jar. You can only scoop it once. And if you're gonna scoop it a second time, use a clean spoon. That's things like that is how you avoid moving germs around and causing problems. So now we'll watch the cleaning. Now in this demonstration, the last cleaning with the foaming facial cleanser was probably 8+ hours ago. So this cleaning is just gonna be with the distilled water and vinegar. But if you're really goopy, then it's okay to use, again, more of a soapy product. If you're just doing a regular cleaning, then you can just use your pre-made bottle of distilled water with the white vinegar. So again, this has been sped up because it does take a lot of time. But you see the general principles, that now we're using the pad dipped in the distilled water with vinegar to get all the goop off. Remember that if you think like bacteria think, they would love some goopy skin, we call it serum in healthcare, as a source of food to set up shop on your face. So we're trying to avoid that. It's been shown in medical studies that the small amount of vinegar actually has an antibacterial effect. Also remember during this time that you're taking all of your medications properly. Those might change through the years. At the time of this video, our most commonly prescribed medications are cefadroxil, which is a common post-laser oral antibiotic, and also Valtrex, also known as valcyclovir, which is a common post-laser antiviral. Particularly if you have a history of cold sores, the antiviral is very important, but most experts in the field agree that you want to be on an antiviral when you do facial laser resurfacing, because even people without a history of cold sores could trigger an outbreak from the, shall we say, the skin stress of the laser hitting your face. Remember, one of the guiding principles of this whole process is frequency, attention to detail, thoroughness. It is not about aggressiveness. It is not about how hard you rub your skin. To the contrary, if you rub your skin too hard, you could break down its natural protective barrier, and that could lead to less optimal healing. Thoroughness, frequency, and really somewhat delicate, just being thorough. We're now applying the Vaseline, which has been scooped into a spoon. Remember, if you have a tub of Vaseline, once you scoop that Vaseline out with a spoon, no going back to the tub unless you have a fresh, clean spoon. So now we're getting a nice layer of Vaseline kind of everywhere. If you get this done in the warmer months, the Vaseline is going to melt a little more quickly on your face. Also depends on your household temperature. It's nice to keep the Vaseline in the refrigerator so it's cool and soothing when you hit your skin. And then when you sleep at night, sleep with a pillowcase you don't like, maybe put a little towel down that you don't mind washing, because you're obviously going to get greasy goop on your pillows when you sleep with all this stuff on your face. Patients often ask, do I need to get up in the middle of the night and clean my face? And generally I say no. Now, if you're someone who gets up in the middle of the night to go to the restroom and you have the energy, maybe doing a quick clean is not a bad idea, but only if you sort of have the energy to do so. I wouldn't say it's recovered. I wouldn't say it's required. And there we go. So now we have the diluted vinegar distilled water wiped down. We've reapplied a fresh layer of Vaseline, and this will be good for the next several hours. Just a little over 24 hours post full face CO2 laser resurfacing. There's been 2 cleanings the day following the surgery, and now we've just come out of the shower. In the shower, we don't let the water hit our face. We kind of just used our hands to kind of just let some water hit the face. You don't want, obviously, the shower head like blasting your gentle skin. And we use the gentle foaming facial cleanser product in this case today. Now that product may change over the years because products do evolve, but at the time of this video, that was the product recommended. So now we're gonna go and put some Vaseline on the skin, but notice closely that there's no weeping. There's no spot for bacteria to call a home because everything is cleaned. And now we're gonna go back to the application of some Vaseline after a dilute vinegar wash. We are basically 2.5 days post laser. Definitely time for a cleaning. Got that little weepy stuff, that's no good there, that's gotta come off. The rest looks pretty good. That stuff on the left corner of the mouth gotta work on. Little weepy stuff there. So still, this is representative of good cleaning, but it is time to clean. 2.5 days post laser. Post-op day 3 in the evening, just to kind of show you what good skincare looks like. Getting a little bit of reveal on some skin there, like around the edges of the mouth, the chin, so hang in there. It's tough, it'll be worth it. It's the evening of the 4th day after surgery. Healing's coming along. This morning, our wonderful model here used a little bit of the gentle soap on the face, and then while in the shower, gently just kind of rub the fingers against the skin to make sure that there's no like skin that was ready to sort of slough off. That's a lovely medical word, slough off. But this is an example of excellent skincare. 4.5 days post CO2 laser. Post-op day 5 in the evening. Morning routine was a shower with the EltaMD facial wash. Remember that product could change over the years. At the time of this video, that was sort of our go-to product. Skin's looking really good. You can tell how she's really turned the corner here. There's a few little spots of extra redness. Now I'm gonna try and show you this spot here. That is B- skincare. So that little area there needs to be cleaned a little better. It's got like a little yellow film on it. We don't want that. We want to see skin. So tonight we're gonna work on that. We'll check in tomorrow to see how it looks. But the rest of the skin looks good. There's some areas that are more red than others. Obviously there's artistic judgment when you laser someone, so don't over focus on areas that are a little bit redder. That might just be where Dr. Mobley thought you need a little bit extra laser. So we're only 5 days out, but we're doing great. We're now at day 9. This is about the point where the healing has pretty much come to at least the substantive end. There's always little details. On our model here, there's a little spot, that right chin, which we're doing some wound care on. Close the eye. Little irritate spot right upper lid. It's not uncommon to have a few little spots that kind of linger, need a little bit more care. So in those areas, we're still keeping some topical greasy ointment on those, but for the most part, we're getting back to normal skin. We can just put some good moisturizing lotion on there. Those products change throughout the years, so at the time of your kind of getting to that 9th to 10th day post-laser, you can always have our estheticians recommend the latest and greatest post-care products for you.